Hey, Dental Nacho's crew, it is Paul, Dr. Nacho. We're going to talk with one of my friends, Dr. Jason Smithson, about how we can make Class 2 composites less annoying, make you feel less like this on the inside. Welcome, Jason, to Talking Nachos. Share with us what's going on in your general dentisting life and what you're going to teach us on Sunday, October 18th. We have Jason zooming in. Last year, he was here live. Just text Class 2 to 215-543-6454. We'll send you an invitation and a coupon. Thanks for being here, Jason.
Hi, how are you doing?
Doing great. So share with us, you came here live last year. We did an amazing course. You're lecturing Cyborg, 2 days of lecture, 1 hour, 1 day of hands-on. But I asked you to take this one thing dentists are frustrated with. I used to do Class 2s, but now, Jason, I share it. I share that joy with my associates.
I'm sure you do.
Yeah, I say, I don't want to hog them all. Why should I hog them all?
Yeah, I'm sure.
So you could be a solo GP. You could be a new associate. You could be a practice owner who does a lot of Class 2s. What are we going to focus on in this course about the Class 2 composite, a routine thing that can cause us a lot of stress?
It's really about what the problems are, to be honest. What is a problem solution lecture? So the bottom line is the Class 2 is the most widely done procedure in general practice. So that's kind of our bread and butter. But the trouble is, even though the Class 2 is a really commonly done procedure, it's actually quite difficult. And it's really difficult to get good contact points. It's really difficult not to get an overhang. It's really difficult not to get voids, et cetera, et cetera. And it's really difficult not to get post-op sensitivity. So what I'm going to do is just go through each of those problems.
Awesome.
And go through a problem-solving approach to each of those problems as we go along. So what you'll end up with in the end is kind of a step-by-step, almost cookbook way, because, I have a fairly kind of foo-foo practice and we do fancy work, but when we do Class 2, we just do an A to Z. We do this and we do this and we do this and we do this, and we do the same thing every time. And there's no reason why a regular GP can't do exactly the same thing.
I love that. Basically, Jason, you're taking this annoyance and you're feeding them nachos. So that's good. It's happier. So, I mean,
maybe.
One of the things, Jason, and you've just been a great guy to get to know, and I know I, joked you're the top chef composite dentist, but when you go watch golf and you see a Tiger Woods or a Phil Mickelson, part of you hopes that they hit a 350-yard drive, but there's a little part of your brain that says, I hope they hit it to the side like me. I hope they mess up. Yeah. What are some of the struggles you have? Like, you're a dentist like us. Are the things that you mentioned, or is this?
Yeah, there are other things like controlling the bleeding, controlling saliva flow in deep boxes, et cetera, et cetera. These are all things. And then also the occlusal anatomy, how you get around, you might do a really nice Class 2 and it looks great. And then the patient closes down and, it's high as hell. And then you have to grind it and it's just like a hollowed out mess. How you get around that.
I always like, Jason, where, you're doing this full contact arts and crafts on a patient. They don't want to be there. You're trying your best, but that they bite down. And if it's high, they never say, oh, it's a little high. They yell, it's high, like almost angry. Right?
And then, and then when you tell them, okay, I'm going to spend some time and adjust that, and it's going to take a few goes to adjust. Every time you put the paper in, they go, it's high, like it's a big,
I know. You're going to leave them like that forever. I appreciate the nice patients. Some are so nice, when you do a closed tray implant crown impression, and I forget to mention that it's in there, some of my nicest patients said, is this going to come out? And I said, yeah, I wouldn't leave it there. Meanwhile, the other ones with 0.1 millimeters high, like Princess and the Pea, go nuts. So if people want to join, they're going to text Class 2 to 215-543-6454. The way this is going to work, guys, is Jason's done for. It's a CE on TV show. You watch live, you're in live CE. We have an awesome deal on it. You can also watch and rewatch it for 48 hours after the show, whether you missed it and you want to get self-study CE, or you just want to watch again and see Jason's awesome material. So I appreciate you sharing that, Jason. Before we go, though, I want you to share, what are some of you do so many different courses. Tell us a little bit about some of these courses that people take hands-on with you. Are they about veneers, high-level aesthetics, Class 2s, and how could people?
Yeah, we do loads. We do a Class 2 course, but we also do a complete anterior course. So everything from the Class 4 to peg lateral discolored tooth, which is quite common nowadays, diastema closure. And then we do a comprehensive posterior course, and we do ceramics as well. We do ceramic onlays, ceramic crowns, ceramic vertical crown, and ceramic veneers.
Cool.
We also do a treatment planning class. So we do pretty much most,
And
not implants,
you and I
but
become friendly, but we'll banter. And you're over there in England. I'm here in the U.S. We talk about the dental school process. Where do you see the weakness in the training? Where you have these dentists who are motivated, enthusiastic, come to your course to learn. If you were in the dental school, you could just wave a magic wand at this. Where's a weakness in this process for people watching that they can make better?
So I don't know about in the US, but in England, well, the UK, at dental school, you're basically taught how to work within the NHS. Now, the NHS, the National Health Service, is a very basic service, probably like PPO type system.
Yeah.
So that's been a big field change because when I went to dental school, not well, 15, 20, 30 years ago, we were taught to practice to gold standard. In other words, it was either as good as it could get or you failed. They were the two options. But nowadays, it's a little bit like, oh, this is how you work within the NHS. And that's resulted in significant skill losses, I think, and really a downgrading in training. And I don't know whether that's the case in the US, but that's pretty alarming.
I mean, it's a good point. It's similar in that the dental school environment just needs to mesh with the private practice environment and show you what's possible. You've been on our podcast and you'll say, I'm Dr. Jason Smithson. You're not going to spend 47 minutes carving occlusal anatomy and doing occlusal composite for an 80-year-old because you say that doesn't make sense at this time. But then also you can do very, very beautiful work when it makes sense. And I think
Exactly.
Dentist decision-making is something I'm passionate about. How do you make decisions throughout your day, whether it's with how does this fit financially, fit with the treatment plan, but to make good decisions, you need to know, right? Like a good sommelier, right, Jason? Whether it's going to be a $30 bottle or a $300 bottle.
Yeah. The other thing missing really is the treatment planning. You learn in different departments and you're never really taught to nail it all together into one.
Yes. So
you treat a patient in like multiple one-tooth dentistry, which is not really a good way to treatment plan.
I'm really with you. That's why I'm a very big fan of the GPR and AGD for this reason. You go through dental school, then you have this one magical year where you can practice on people you're never going to see again. And you get supervision, and it's not from the technical aspect, it's from the customer service. Because you can call over an instructor who's an oral surgeon and say, I can't get this root tip out, help me. You can call over a prosthodontist and say, this implant framework is off. So you really get this one magical year to work on treatment planning, to work on those things before you go 30 years in private practice. And in the US, that to me is a valuable year to test these things out in our culture.
Is that done in like a hospital system?
Hospital setting, usually for a general practice residency. You also get to see what happened with me is on my 29th birthday, I was working on a Saturday and a girl was hit with a field hockey stick over at the high school and I did a GPR. So when she came over, her front teeth were hanging. I stabilized it, got it to an oral surgeon. If I hadn't done a general practice residency, that really would have made me freak out. So when you learn really tough stuff, you learn how to not freak out as much, even if you're not going to be the one doing it. So that's just, I appreciate you sharing about the dental training mindset. In the US, are most of the dental instructors in England, are they also practicing or are they just in the dental school?
You have kind of like faculty, which are mainly research people, which are in the dental school. And then you have kind of visiting, which are from general practice. But I mean, we always had that. But when I had visiting, in the late 80s, early 90s, they were serious guys, serious private practitioners. And now, not so much because you have to have an NHS number to work in the dental school. So I, for example, could not work in the dental school because I don't have an NHS number.
It's always a shame. I was thinking, I see you're awesome, but how old are your children? How old are they?
12 and 14.
So, I mean, I have 2 and 6. So a 2-year-old issue is different than a 12-year-old issue. And I'm using this example, right? Like I got 2-year-old issues. You met Drew. You don't have those. You have 12-year-old. A lot of the
I have 14-year-old issues. They are big issues.
Would you trade back for what's harder, 14-year-old or 6-year-old issues? I think
No, six-year-old is easy because they believe everything you tell them.
Yeah, I like that.
Which is a beautiful time of life.
What I find is, and I think what you said before we wrap up is, it would be great if people like you and me and Matt and Artie and Todd and other people and people across it could teach in a dental school, because it's like teaching while you have children and you're on your game. A lot of times we have people who are grandparents teaching, who are great dentists, but they're not in that mode. And then you have other people who are out of private practice totally, so they just don't know the constraints and the challenges of running a private practice. And that's why I think we just need more of that. It sounds like in the 80s and 90s, you guys had a better system for your faculty.
It was maybe harder, but we had a better system, I think, definitely.
The training was probably more
the training was more brutal. I can remember guys, you do a crown prep and you'd have to wax it up, and then they'd take the model and turn it upside down. If it fell off, you failed.
Yeah,
we used to stick it on with sticky wax.
Yeah, you guys watch the Hunger Games over there? I always feel some of those dental student Hunger Games are tough.
Yeah.
I appreciate, Jason. If people are just watching this and they caught this end, how could people find out about you and what you do? Do you have a good website, or how could they reach out?
I have a website, it's jasonsmithson.com. It's pretty easy to remember.
Well, you're part of the Nacho world. I would love having you in person. We'll do that hopefully in 2021. But for now, we'll stick to the CE on TV show. So everybody watching, just text in class 2 to 215-543-6454. Go to dentalnachos.com and you can get a pass at a discount from now for the end of this week to watch in CE on TV with my friend, top chef dentist, Dr. Jason Smithson. Thanks, Jason.
Thank you very much. Thanks.